BPH is benign prostatic hyperplasia. Now, but first discuss about the BPH is the enlargement of the prostate. There is benign enlargement of the prostate. There will be hyperplasia of the prostate. That is called the BPH. It usually occurs in the old age men greater than 50 years of age, and the patient usually complains of dribbling of the urine, incomplete voiding of the urine. So let us first discuss the lobes of the prostate and the zones of the prostate. Okay, so here you can see the prostate lobes of the prostate. The prostate is having anterior lobe, the middle lobe, and the posterior lobe, and the two lateral lobes. Okay, these are the lobes of the prostate. One anterior, one posterior, one middle, and two lateral lobes. Now let us discuss about the zones of the prostate. The prostate has three zones: one central zone, transitional zone, and the peripheral zone. Here you can see there are three zones of the prostate: central, transitional, and the peripheral zone. So BPH usually involves middle lobe and the transitional zone. So let me show you the BPH involvement. If I can show you, the BPH usually involves like this. Middle zone, medial lobe, and the transitional zone it involves. So in the middle lobe we have the urethral opening. So you can imagine if the prostate is enlarged. Okay, let me show you. If there will be prostatic enlargement like this, okay, it exerts pressure on the urethral opening and the patient complains of dribbling of urine. Okay, because there will be enlargement in the middle zone and the transitional middle lobe and the transitional zone, and in the middle lobe we have urethral opening, and if there is enlargement there, it compresses on the urethral opening and the patient complains of the dribbling of urine and incomplete voiding of the urine, etc. These are the presenting complaint of the patients on the opening, and the patient complains of the dribbling of the urine, etc. This is the primary presenting complaint of the patient with the BPH, with the benign prostatic hyperplasia. Now let us discuss about the BPH. BPH is the most common benign nodular hyperplasia. It occurs in men older than 50 years of age. And the man complains of the dribbling of the urine, and he complains that his urine is not completely voiding off. What is the pathogenesis of the BPH? We have in normal cases we have the normal testosterone. In the BPH, the testosterone is increased. Okay, the testosterone is increased, and if the testosterone is increased, we have two types of cells in the prostate. Okay, one are epithelial cells. These are epithelial cells, and other ones are the stromal cells. Okay, in epithelial cells we have 5-alpha reductase type 2, which convert this testosterone into DHT, that is dihydrotestosterone. And when the DHT is there, it attaches to the androgen receptors in the nucleus, and it produces growth factors, and there will be abnormal growth. Once again, if there is increase in the testosterone, okay, so in epithelial cells we have the 5-alpha reductase type 2, okay, in epithelial cells of the prostate. Okay, and the 5-alpha reductase type 2 convert this testosterone into dihydrotestosterone, and this dihydrotestosterone attached to the nucleus, attached to the androgen receptors on the nucleus of the epithelial cells, and there will be GF growth factor productions, and will be abnormal growth in the epithelial cells. Okay, the stromal cells, we have two types of cells in prostate. The epithelial cells proliferation mechanism I have taught you. Now there are other types of cells that are stromal cells. In stromal cells there will be no alpha reductase 5-alpha reductase type 2. Okay, reductase type 2 is not there. Reductase 2 is not there. Okay, so in stromal cells there will be direct the dihydrotestosterone goes directly into the stromal cells, because 5-alpha reductase type 2 is not in the stromal cells. And the stromal cell, it do the same, it attaches to the androgen receptors nucleus on the nucleus, and there will be production of growth factor, and there will be abnormal growth also in the stromal cells. So in both the epithelial and stromal cells there will be abnormal growth and proliferation that is responsible for the enlargement of the prostate. We called it as a BPH, benign prostatic hyperplasia. Basically that is hyperplasia. One thing that I also want to mention here is that So let us discuss about the effect of estrogen on the BPH, on the development of BPH. Now, if we have dihydrotestosterone in the stromal cells, it activates KGF, EGF, and IGF. KGF is keratin growth factor, EGF is the epidermal growth factor, and insulin like growth factor is IGF, and TGF beta transcription growth factor beta. Okay, it if the dihydrotestosterone is there, it activates both these and this. Okay, TGF beta is responsible for epithelial cell death, and all these are responsible for epithelial cell growth or proliferation. So there will be also death and proliferation is also there. This is in case of dihydrotestosterone. So it means when we have more and more dihydrotestosterone, obviously the growth will be also there, but there is some epithelial cell death also there. Okay, these are more, and this is comparatively less, but there is some epithelial cell death in case of DHT. In case of estrogen, what happens is if the body is start producing, it is considered that estrogen also plays roles in the pathogenesis of BPH. That in case of estrogen, what does it do is it acts on these and increases KGF, EGF, and IGF, and inhibit TGF beta. Okay, so estrogen inhibit TGF beta, so there will be increased epithelial cell proliferation, and if it decreases the TGF beta, there will be decreased epithelial cell death, because TGF beta is responsible for the epithelial cell death, and what estrogen do is estrogen inhibit this TGF beta. Okay, so these are abnormally produced in both the DHT and estrogen, but DHT doesn't exert inhibitory effect on TGF beta what estrogen does. So if we have abnormal estrogen, it triples the effect of having the BPH. What does it mean? It means that it increases the growth factors that is responsible for epithelial cell proliferation, and decreases the growth factor that is responsible for epithelial cell death. So proliferation is there, but that is not there, so it results into the BPH. This is all the concept. So estrogen basically triples the effect of having the BPH. If we look at the histology of BPH, we see the growth. The BPH basically involves the middle lobe and the transitional zone, and we see the many hyperplastic nodules. If we look at the growth of the prostate, we see many nodules in the prostate, nodules formation in the prostate, and in the growth, if there is fluid inside the nodules, we see that the nodules look like yellow pink, and if there is fibromuscular stroma, nodules look like are firm and they look pale gray. So this is all about the growth. Looking at the growth, if it usually involves the middle lobe and transitional zone, there will be formation of nodules. If there is fluid, prostatic fluid inside the nodules, we see the nodules as the yellow pink, and if there is fibromuscular stroma, no fluid inside the nodules, we say the nodules are firm. What is the microscopy? In the microscopy, we see involutions or papillary infoldings. We see double layer epithelium. The outer epithelium is cuboidal, and the inner columnar epithelium we see, and inner columnar epithelium is secretory, and we see the prostatic secretions, that is corpora amylaceae. In normal prostate, we also have double layer epithelium. So in the BPH, we also have double layer epithelium. The difference is we see the infoldings there, we see the prostatic secretions there, that is corpora amylaceae. Now let me see you the structure of the BPH, the histology of the microscopy of the BPH. Features in case of prostatic enlargement. In case of prostatic enlargement, basically the prostate is enlarged in the middle lobe and the transitional zone, and there is urethral opening there. So the enlargement exerts pressure on the urethral opening, and the patient complains of dribbling of urine, incomplete voiding of the urine, dysuria, and painful micturition. These are the presenting complaints of the patient, and the patient is in the age of the 50 years and above 50 years. And there will be increased risk of kidney and bladder infections also. And what is the treatment? In the treatment, we give 5-alpha reductase inhibitors. As you know that the 5-alpha reductase is responsible for the conversion of increased testosterone into the DHT, dihydrotestosterone, that is responsible for the pathology of developing BPH. So we give 5-alpha reductase inhibitors. We give transurethral resection. We do transurethral resection of the prostate, that we resect from here. Okay, we do resection of the prostate, that is TURP. We do it with nowadays we do HIFO. What is HIFO? HIFO is basically high intensity frequency ultrasound, and we treat the BPH by this. We also treat it by the laser and by the radio frequency ablation. These are all the treatments of the BPH.